This is back to the mammogram. Were you also lumping into that, the breast MRI, or is that a separate issue? And if so, what's your opinion on the breast MRIs?
There are a lot of people on this panel who are going to have opinions about that. Who wants to go up for after breast MRI? All right, I will. So breast MRIs are more sensitive than mammograms. They can unquestionably find cancers, particularly in younger women, that can't be found with mammograms. The problem is they don't say this is a cancer, they say this is a spot. And once a radiologist sees a spot, he wants to call somebody with a sharp instrument. And there are a tremendous number of false positives. So most people and most recommendations say that routine MRI screening for asymptomatic people without lumps is not indicated. However, for women at particularly high risk with strong family histories, carrying BRCA mutations, there, the likely possibility that a spot might be a cancer is so much higher than in the general population that it's worthwhile. I mean, everyone knows, and there are women in this room I know for a fact who, under age 40, have had breast cancer. But thank heavens, it really is quite rare in younger women. And you would wind up doing thousands of needless biopsies if you start doing MRIs in women without substantial risk factors. So at the present time, that's not a recommendation of any group that I'm aware of.
Mark, can I say something?
Where? Yes, of course.
So the other issue about MRI, I think there's really good potential to actually have some idea of the function of what is causing that lump. MRI is a little bit different than X-rays. X-rays just give you a shadow. MRI actually is looking at the chemical composition of what that shadow, why that is casting a shadow. So there's many more pieces of information you can get out of an MRI. However, I think the major limitation is just the instrumentation and technology. So have people had an MRI? So if you've had an MRI, you've been in this giant donut, it's cooled with liquid helium to get close to absolute zero as possible. The magnet is slamming around, and that's the banging because I've got to change the magnetic field to really look at the ability to see the lump. One of my colleagues, I'm speaking for him, is named Mike Garwood, who's been very interested in the idea that perhaps you could get similar information if you just wanted to image the breast. The MRI machines that we have are for imaging the head and the body and lots of other parts, but if you just wanted to image the breast, there's real potential that you could have a fixed magnet, so you wouldn't have to have the slamming and the liquid helium to cool the magnet down, and put that in your mammography unit and develop a new algorithm to the MRI. So we've been very interested in trying to move that technology forward with the idea that maybe we could do something better than mammography.
And I would just add that there are other uses of MRI. So Dr. Yi and I are both involved in a large national trial called ICE-BY-2, in which we use MRIs in women who we know have breast cancer, who we're treating before surgery with medications, chemotherapy, and other new drugs. We use the MRI to see if the tumor is responding. And so trying to use different techniques with the MRI and different ways to image the tumor while it's still there will give us an idea of whether that tumor is sensitive to the drugs or resistant to the drugs. And that can be a really powerful tool in developing new drugs for the cancer, because it really gives us sort of the laboratory in your body to see what the cancer is doing. But that is still investigational and something that we use as part of our clinical trials.